The maxillary artery is one of the terminal branches of the external carotid artery. It can be divided into three parts: retromandibular, pterygoid, and pterygopalatine. Beginning with the branches of the retromandibular section, we have the deep auricular artery, which supplies the external acoustic meatus, the anterior tympanic artery, supplying the tympanic membrane, the middle meningeal artery, which will travel to the cranium through the foramen spinosum and supplies the dura and calvaria, the accessory meningeal artery, which supplies the cranial cavity, and the inferior alveolar artery, which descends through the mandibular foramen to supply the mandible, gingiva, teeth, and floor of mouth. It exits the mandible via the mental foramen as the mental artery. The pterygoid portion of the maxillary artery supplies blood to the muscles of mastication and the buccinator. The pterygoid arteries supply blood to the medial and lateral pterygoid muscles. The deep temporal arteries supply blood anteriorly and posteriorly to the temporalis muscle. The mesenteric artery supplies blood to the masseter muscle, and the buccal artery supplies blood to the buccinator and the mucosa of the cheek. The third section of the maxillary artery is the pterygopalatine area. The descending palatine artery branches to the greater and lesser palatine arteries to supply the mucous membrane and glands of the palate and palatine gingiva. They'll anastomose with the ascending palatine artery from the facial artery. The posterior superior alveolar artery supplies the maxillary molar and the premolar, the buccal gingiva, and the lining of the maxillary sinus. The infraorbital artery is a terminal branch of the maxillary artery, and it's going to travel through the inferior orbital fissure, the orbit, the infraorbital canal, and then exit the infraorbital foramen. It will supply the inferior eyelid, the lacrimal sac, the infraorbital region of the face, the side of the nose, and the upper lip. The middle and anterior superior alveolar arteries branch off from the infraorbital artery. They supply the maxillary sinus and the upper teeth. The sphenopalatine artery is a terminal branch of the maxillary artery. It helps supply the lateral wall and septum of the nasal cavity and the paranasal sinus. The pharyngeal artery branches off to supply the roof of the pharynx, the sphenoidal sinus, and the inferior part of the pharyngotympanic tube. The artery of the pterygoid canal also branches off to supply the superior part of the pharynx, the pharyngotympanic tubes, and the tympanic cavity.